Good evening, sir. Good evening, sir. My name is JosherAlDaniel. I'm Ray, and I am a student nurse uh, uh, here in AUP. And you already know since we're roommates. And
Yes.
so tonight, what we're doing is that I will be teaching you about chronic sinusitis. As we have already interviewed you last time, you already said that you already knew a lot about chronic sinusitis, but let's just refresh your mind and reintroduce you to some things, or maybe give you some tips or things to do. So,
Okay.
first and foremost, can you introduce yourself, sir, please?
My name is Ardania.
Ah, okay, Lance. So, okay, I will show. Can you see? Can you see the
Yes.
screen? Okay.
Yeah.
So, let's start. So, what will we So the title of this presentation is Understanding Chronic Sinusitis, Cause and Effects. Do you know why yours is chronic sinusitis? Do you
No.
know what chronic means or something like that? Okay,
No.
we'll go over that after this. So these are the things that we'll be discussing. There will be more, but let's just go for this. First is Introduction to Chronic Sinusitis and Anatomy, the sinuses, causes, symptoms and effects, diagnosis, treatment options, prevention strategies, and conclusion. So let's start. So chronic sinusitis is a long-lasting inflammation or swelling of the sinuses that continues for 12 weeks or more, even after treatment. So unlike acute sinusitis, which is a short term, chronic sinusitis is persistent and needs ongoing care to manage effectively. So, for you, sir, you have been having this sinusitis since when?
Since I was a child,
Oh yeah. Uh, so now it's how how often does your sinusitis occur? Like some
occurs frequently.
like daily or something like that, right?
Yes.
It just goes anytime
Yes.
and it's very bad, right? So
Not
that
so much.
is not so much, but it's there, it's troubling you. So that
Yes.
is chronic sinusitis. It keeps on going and going. So ever since you're a child, right? Like this, 12 weeks or more. Even after you already went to treatment before and you already had some medicines, over the shelf medications. So that is the difference between chronic and acute. Acute is just short term. It's like when you get hospitalized, hospitalized, and you'll be done after a short period of time, and then you'll be back to your daily stuff. Now, chronic sinusitis can lead to various symptoms that affect quality of life, like what you have been experiencing, right? Like runny nose. You have runny nose all the time, right? And not all the
Yeah.
time, but yeah. And nasal congestions, facial
Yes.
pain. Do you get facial pain sometimes?
I no, 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 no.
Oh, no. So it's just, but there's times, right? The facial pain or something like that, or pressure.
Oh yeah, pressure.
Yeah. There's always thick nasal discharge you mentioned before, and you can't, you seldom sense, you seldom smell anything when we
Yeah.
see each other. Yeah. So those are some symptoms. Now, let's check. Yeah, yeah. Wait. beforehand. I can't see you. How can I see you? Paano ba to?
Surveillance.
Ganyan ba? Huwag na lang. So, so this is the anatomy of the sinuses. It's a structure of the sinuses. The human skull has four pairs of sinus cavities. So you have the maxillary here, right here. If you press that or palpate it, you can you can feel something like in when you breathe. There's something there. That's the sinus. Do you feel it? Did you? I can't see you. Here. Oh, you're gone. This is the maxillary sinus. Can you see the presentation? Okay. So maxillary, and this is the uh facial here at the top, the eyebrows area. Then the ethmoid is right here in the middle. There are ethmoids. So there's some small like sinuses, and then the sphenoid at the back are just beside the ethmoid. So those are the four structures of the sinus cavities. These sinuses are connected to the nasal cavity. So whenever you feel like you can't breathe or you can't, uh, like you have things you have nasal congestions or such like that, it's not only here that that the sipon is. It's also here, here, here. It's all over this area. So let's continue. Ah, right. So what are the functions of the sinuses? As you may know, sinuses moisturize the air we breathe. So when we breathe through our sinuses, it removes or moisturizes the air. So it removes some dust or some pollens. It will be gathered by the nose hairs, like, and so that we'll be able to breathe fresh air. They help
Ibang isa pa
improve.
kayo.
They also help improve our voice resonance. So when do you notice every time you do this like this, it changes your voice, right?
Yes.
Especially when singing. Singers usually use nasal or they use nasal cavities to enhance their resonance or something like that. So next, another function is they protect against pathogens by trapping dust and microbes. Yeah, I already mentioned this earlier. It can protect you from any pathogens or pollens or something like that. Next, causes of chronic sinusitis. So allergens, as you told me before, you had allergies, right? One of the causes
Yes.
of your sinusitis, allergies and
Yeah.
environmental irritants. So those are one of the things why chronic sinusitis is caused. So next is nasal obstruction. So nasal polyps. There are some like pimple-like structure inside the nose, something like circly like thing in these above your nose. And there are some other obstructions as well in the nasal cavity. It can be the things in your nose is produced. Next is the infections. Well, Do you usually get infections in your nose or is just allergies?
Occasionally.
Oh, occasionally. So it also
Yes.
has, does it affect your respiratory? Oh yeah, of
Uh,
course. Is
no, I
nose is
don't.
part of respiratory. So yeah. Next is structural issues. So you don't have this, but some people with chronic sinusitis have deformed or yeah, deformed noses or some passages are blocked in the nose. These are one of these are causes of chronic sinusitis. Next are the symptoms and effects. So common symptoms that you feel when you have this. So nasal congestion. Well, you have that right, and you have difficulty
Yes.
breathing through your nose. Some may have facial pain or facial pressure, and it reduces sense of smell and taste. Do you have when you have reduced sense of smell? Do you also experience loss of reduced sense of taste?
Sometimes.
Awesome. Okay, but do you have persistent cough though?
Sometimes, but it's only if I have a fever.
Uh, okay. So the effects on quality of life. So difficulty in sleeping due to nasal blockage. Do you experience this? And every time you sleep, uh, so you have a hard time sometimes sleeping. Impaired daily activities due to discomfort is very common as well. Every time you go
Yeah,
to school or something like that, you have to emergency like go out outside of the classroom just to
blow
remove
my
the
nose.
yeah blow your nose and something like that.
Yes.
Yeah. Possible development of other infections such as asthma or bronchitis. Did, did you have any of these? Asthma or bronchitis before?
So I
You don't have asthma.
haven't
Uh,
yet.
you have asthma?
No.
Oh, no. Okay. So diagnosis. So these are the ways, other ways you can uh, help your chronic sinusitis. Medical history review and physical examination. So you have already had this before, right? When you were a kid, when you were a child, and you did do things, you did comply, but still didn't stop, right? Yeah. You can also do nasal endoscopy to visualize nasal, but doble to. Nasal passages. So, have you, na-try ka na ba nito? Nasal endoscopy? No,
Mm,
noon.
I think so, pero I'm not sure.
Oh, yeah. So it shows the passages or visualize nasal passages here. That they will know if there's something wrong or what's happening. Imaging tests, such as CT scans to identify inflammation or structural problems. Yeah, those as well. Now, these are the treatment options. Nasal corticosteroids to reduce inflammation. So, this is a medicine to reduce nasal inflammation. And next is antibiotics. Whenever you have bacterial infections in your nasal air, in your nose, you can use antibiotics. Next is for you, antihistamines is very important since your chronic sinusitis is allergy related. Yeah. You did have these before, right?
Yes.
Oh, and since it still persisted, you just stopped. So these are the medical treatments in the left. The right is surgical treatments, endoscopic surgery to remove obstructions or polyps. Have you considered any surgical treatments before, right? Uh, you're, you mentioned that.
I did, but not feasible or finances wise yet.
Uh, I mean, it must be very expensive. Balloon sinuplasty to widen sinus openings. I've
Yes.
seen some like these in chiropractors. They stuck some balloons in the nasal cavity so that it will expand. I know how they did it, and they cracked and they were able to breathe easily. You should go to chiropractor. I'm just joking. I'm not just joking, bro. Now this is prevention strategies. Avoid allergens. So in your environment, especially here when you go back here in AUP, avoid known allergens and irritants. What are your allergies again? Dust, right?
Yes,
So
dust and other small
are you allergic to some pollens and something like that?
probably, but it's only a mild
So you should maybe practice using mask to reduce allergens or irritants, something like that. Nasal hygiene. So maintain good nasal hygiene. So what you're gonna do is there's a cleaning method. I will show this later. There's a video after this. This is moist environment. Keep the environment moist to prevent dryness in the nasal passages. Also, we can do this in our room. We can buy something like I forgot what's the name. The moistening for the room. The what is that circle thing? The one that's like steam going up. Humidifier, right?
humidifier.
Yeah,
Yes.
you could buy that for to help you. But well, let's consider that as an option. This is nasal. Yeah. Now I'll show you a video. There's another way in nasal hygiene. Uh, let me show you. Uh, okay. So here, all right here. So this is it. Can you see it?
Yes.
Okay, I'll play it.
Can you turn subtitles?
What?
Can you turn on the subtitles? I
Oh
can't
yeah.
hear the
Okay.
audio.
Sorry, sorry. Right. Let me restart as well.
Okay.
Okay. Sinus rinse. Right.
Wait lang, napanginabuhat.
Okay.
No.
3, 2, 1.
Ah,
You can buy just the bottle or something like that and just use distilled water.
how do I apply
Or
that?
uh, uh we're
Oh,
gonna we're gonna watch it now.
okay.
Yeah.
I have
Yeah, look at
something
that.
like okay, never mind. I don't have something like that.
Yeah. But we can maybe consider buying. Maybe I can buy for you. This is just one. Is reusable. right? Nasal rinse. Uh, it's just you push. You can see here. It goes through all your sinuses, the facial, the maxillary, the sphenoid, ethmoid. It He says it feels good. Yeah, yeah, yeah. So that's the video. I have another video here, just a short one. Just wait, so that yeah, it's just a repeat of what I've said so far. Right? Someone calling you?
No.
Okay. We'll have a quiz, short quiz after this. Just 8 questions. So let's watch this. Yeah. Mm-hmm. I wait. Can you see my mouse?
No.
Oh
Ah,
yeah.
yes.
So these three here, these are the ethmoid. These are this is the facial, this is the sphenoid. Can you see?
Yes.
These three small things, they are ethmoids. Ethmoid uh, cavity. This is facial at the top or the forehead. This is sphenoid at the back. And then this area right here, or can't be seen, it's in a lateral position. But if you can see it up front, it will be right here, the maxillary area, beside the noses. The nose. Yeah,
Take it to the-
yeah. Right here. It's, can you see it?
Yes.
Yeah. Out, frontal. Face. Mm-hmm. Yeah. You can see here, this is the superior area. It goes up, and this is the middle, and this is the inferior, right here. There's the middle, and then there's the superior.
Yes.
This, I think it goes up for this area right here, and then yeah, yeah, deviated. Yeah, yeah. So this is the what you were uh uh you're gonna do right
Mm,
before
mm.
the lance.
Yes.
Yeah.
Yes.
Okay. Let's continue. Let's continue since the meeting time is almost ending. Yeah. Sinus surgery. So that's all. So did you understand some things there?
Oh, yes.
Yeah. So that's the conclusion. So chronic sinusitis is a manageable condition with proper understanding and treatment. So if you'll be able to understand or be able to properly know the things to do about chronic sinusitis, then it will be a manageable condition. E- Even if you have chronic sinusitis, you should wear masks or do nasal hygienes a lot more so that it will reduce since your chronic sinusitis is caused more by the allergens. This is early diagnosis intervention. Yes, you already had this before. Can significantly improve the quality of life for affected individuals. So you should at least go to some clinics or something like that every at least once a year. Do you do those? At least once a year to check for things.
Yes.
Yeah, that's for our presentation. So next part, we doing your short quiz. So can you see?
Not yet.
Okay, well, let me share. I just want you to see. You can see now?
Yes.
Okay. So number one, what is chronic sinusitis? A short-term cold lasting less than a week. B, an inflammation of the sinuses lasting more than 12 weeks. C, a type of ear infection. D, a seasonal allergy.
B.
Okay, B. Correct. That's good. Next is
Let's go.
which which of which of the following is not a common symptom of chronic sinusitis? Which between the four there?
It's. I think it's C.
Yeah, itchy skin rash. Well, you can't get skin rash inside your nose. Next, this is true or false. Chronic sinusitis can be caused by allergies, infections, or structural issues in the nose. True or false?
True.
Okay, correct again. I know you're very smart, bro. Let's go. Skip at it. Which of these practices can help manage chronic sinusitis? There are four there. Using
Hmm.
nasal saline.
I think it's all of. I think it's all of them.
Yes, correct again. Staying hydrated, avoiding known allergens, all of the above. Next is number five. Which of the following is a common trigger for sinusitis syndrome? Symptoms.
Uh, I think it's dust exposure.
Correct again. Okay. Dust exposure. Of course, you won't get any sinusitis symptoms from bright lights, loud
Yes.
noises, and well, maybe cold temperatures, but
It's considerable, but it's mostly dust exposure, I think.
yeah, it's more on the dust exposure. So next is what is a recommended lifestyle change to help prevent sinusitis flare-ups? Drink cold beverages, sleeping less than 5 hours a night, ooh, maintaining a clean living environment, or letter D, ignoring allergy symptoms.
I
What
think
is,
it's C.
yeah, maintaining a clean living environment. So let's clean our rooms all the time.
I think
Of
I
course.
sleep early.
I think I'm also having a problem and I can't breathe. Okay. Which sense is commonly affected by chronic sinusitis? Number seven.
Uh, I know. Smell.
Oh, of course. Smell. Number eight. True or false? It's important to consult a healthcare provider for persistent sinus symptoms. True or false?
True.
Okay. So let's see the uh, answer keys. So for number one, letter B, correct. Number two,
Eh,
C, correct. Three, A, correct. D, correct. A, correct. C, A. You're so smart, bro. Okay. Let's continue next, but Let's stop for now because there's only 1 minute remaining for Zoom. Let's go back again, right? I'll just
Okay, okay.
restart.
Okay, okay.
Okay. Hello, welcome back again. New meeting. It'll be fast. We're almost done. Uh, I'll share this for now. So let's skip those. Let's go to this part. So identify common symptoms triggers. So these are the common symptoms and triggers of sinusitis. Runny nose with thick yellow or green mucus. Can be some pus as well, right? Stuffy nose, facial pressure, bad breath, cough, headache, loss of smell. Do you experience these
Yeah, I'm
about
currently
bad breath?
experiencing stuffy nose right now. I
Yeah,
think I'm.
yeah, you're blowing nose. How about bad breath?
I don't think so. I should brush regularly.
Okay. So let's just have a bit of oral quiz. I'll just ask you about four, give me four of those
More.
symptoms. Yeah, just four symptoms. You already know these.
Uh, Pain or pressure in the head.
Yeah,
Uh, what do you call this? Stuffy nose,
yeah,
difficulty breathing,
yes.
and ano, loss of smell.
Okay. Yes, let's go. Now, understand the importance of proper sinus care and hygiene. So, so, imagine, so let's see here. Can you see the screen?
Yes.
Managing sinusitis properly helps reduce symptoms, prevent complications, improve. So if you manage your sinusitis properly, like wear mask or do some nasal uh hygiene, such as those nasal sinus things. I forgot what it's
Nasal,
called.
nasal rinse.
Yeah, the
Rinse.
silent rinses. You'll be able to clean your nose, or you'll be able to make it stay hydrated and avoid triggers of allergens. Now, this video clip here, we already watched it earlier. Avoid triggers and stay hydrated. Proper care prevents sinus infections from becoming chronic and supports faster cleaning. Next, identify different. Okay, so these are. I have a poster here. Let me show you.
Mhm. Just see your face. Just see your face.
Where is it? Oh, I have it here. Right here.
Mm.
So these are the environmental factors that can trigger sinusitis. Can you see it?
Yes.
So here are air pollution. Yeah, especially in the modern world, or especially here that we're in this current world. There's air pollution everywhere. Dry
Yes.
or cold air, especially in cold seasons, or
Yeah.
tagulan. There's pollen and allergens. Indoor irritants like cigarillo or dust mites, molds, strong odors from cleaning products, or even perfumes. There's a cigarette smoke. Yeah, I already mentioned this. Even secondhand smoke from other people, smelling those can. Yeah, I think that those are much more worse than just doing it by yourself. The next is occupational hazards. Exposure to chemicals, dust, or irritants at the workplace. Especially when you walk to school, right?
Yes.
It's dusty. Sometimes
Yeah.
the air or the wind blows very dust everywhere. Last is sudden weather changes. Rapid shift in temperature or humidity. Yeah. Suddenly becomes cold or something like that. So these are the tips to reduce exposure. I mentioned this before. Humidifiers. Keep windows closed during high pollen seasons. Oh yeah, should keep the windows closed. Avoid smoking. We don't do those here. But when you're at home, especially there, I hope you're not exposed to some smoking environments right there. Outside,
No.
okay. Clean living space regularly. So we should really clean this room all the time. So what are the environmental triggers again? Can you tell me
Pollution,
more?
pollens,
Yeah,
uh, dry or cold weather.
yeah. At least just four. Give me, give me
So,
at least two na lang. Other than those three that you mentioned.
uh, what was it? Wait, wait.
Weather,
I mentioned weather already.
you mentioned it already.
I know bacteria and dust.
Yeah, these are the ones. Occupational hazard. Bacteria can also be, or pollen allergens. So, yeah,
Yeah.
those are the things. Now, yeah, I already showed this as well. This video clip right here, where we do sinus saline rinses. Clients should be able to perform nasal rinses. We don't have it. We can. I hope you saw the video, right?
Yeah.
Maybe we can
I,
do those in the future or
I
something like that. But you already saw it, so you can maybe perform it next time, right? It's very easy, anyways.
I only have nasal spray.
Okay. Oh, oh yeah, that's still also works. Next is wait. So next thing we need to is commit. Okay. So there are some lifestyle changes that you should really consider, especially since you have chronic sinusitis occurs anytime, anywhere, right? If you drink a lot of water, right? Of course,
Yeah.
keep ordering water, but at least make sure not to overly drink cold water. You have that habit. I know that I am your roommate ever since. Should at least lessen cold water a bit. Not too. You can drink maybe cold, but not too cold. Like yeah. Next is get plenty of sleep. Yeah,
Yeah.
that's a very big problem, especially to us since we have our academic stuff. Uh, we should always sleep early. Uh, and then also, yeah, the saline nasal rinse. I already mentioned that. Maintain cleanliness
Yes.
of the room. Yeah, and diet
Yeah.
changes. Oh, since we already have calf load, we already have calf here. I know you already. We are already vegetarian, so you don't really have to change anything unless yeah.
Yeah.
So this thing is wait, I'm lost. Oh, here. And I'll show you the blog
Mm.
right here. So these are the things that's for living with chronic sinusitis. Like I mentioned before, lifestyle changes that you can maybe, yeah, here. Always stay
So,
hydrated, go outdoors, try fragrance-free products. Yeah, I did have problems with fragrance or perfumes when smelling.
yes.
Yeah, you should maybe try using uh soft, a much more not strong fragrance products. At least just I don't know how to describe it in English. Smooth, the smooth smell. This is practice good nasal hygiene.
Wild.
Stress management. Yeah, you always get stressed, bro.
Yeah.
You always get stressed.
Yes.
Yeah, it's a very big. You should really, look at this. Stress can weaken your immune system and exacerbate inflammation, making your sinuses much worse. So let's not be stressed by things. Let's continue with life. Okay, we're almost there, bro. So I want you to, no, to, I want you to encourage you that to keep learning about sinusitis, okay? Because you not know it will get much worse next time. Uh, uh, yeah, you should take care of yourself more. You should use masks or do nasal hygiene a lot more. Maybe just simple habits like even just staying hydrated and cleaning your nose can help prevent problems. Staying focused on your health will make you feel better and more in control. So let us stay vigilant always, bro. Yeah, you're eating. Okay, almost done. So I'll be sharing to you this. Can you see the screen? This is the last one. This is a document or a research about mechanisms and pathogens, genesis of chronic rhinosinusitis. So I will not read this because it's already so long already. I can just I can give you this link later about your. It's almost the same as that. Still a chronic, but
Yeah.
nasal chronic rhinosinusitis. So a bit different, but still the same. Cushion, both and means from a very. So yeah, that's all. So I want you to stay vigilant always, bro. Always keep learning and do what do you have to do again? Uh, in your free time or even just daily stuff to help your sensitivity? Can you give me some things?
I'll passively learn about my condition
Yeah,
while also applying what I should do.
yeah.
Like,
What are the
think-
things that you should do again? Oh yeah,
like
continue.
not drinking cold water, also
Hey, hey.
getting good sleep, and making
Yes.
sure the room clean.
Okay. So okay. Thank you for listening, and thank you for cooperating with me and listening to the everything that I've done. I hope you have a very nice night tonight. You'll be able to sleep well. Always pray and always know that God is always with you. And I know it chronic sinusitis has been with you for a very long time. And I know that if you pray to God, I know that it will be lessened. You'll be fine. So that's all, bro. Thank you for listening, participating.